Great, good afternoon. It's good to see you all. Welcome to the Endlinger Center Highlight Seminar. This is our first for this academic year. My name is Wei Pan. I am assistant professor joined between Endlinger Center and the School of Public and National Affairs. So it's a great honor of mine to introduce our speaker today, Dr. Donna Vorhees from the Health Effects Institute. Donna Vorhees leads HEI Energy's work in providing impartial science about potential community exposures and health effects associated with energy production, with an initial focus on unconventional oil and gas development. In this role, she oversees educational and outreach efforts and works with the Energy Research and Review Committees and HEI Energy staff to develop research proposals, oversee funded research and associated community engagement, and review investigator reports. Vorhees has 25 years of consulting experience assessing multi-pathway chemical exposures in indoor and outdoor environment, quantifying human health risks, and communicating risks to affected communities in the United States on behalf of the government and private client, and internationally on behalf of the United Nations Environment Program. She has done so many fascinating work. I'm not going to read the whole bio. You can find them online. But me personally, I met Dr. Vorhees about 2 years ago at a stakeholder engagement workshop in Washington, D.C., where we focused on how can we make our research on energy and health more relevant to federal and state level decision makers. What I have learned so much from Donna over the past few years is that yes, it's important to do cool work to advance the science frontier, but at the same time, we also need to think critically about how to make our science more useful and also more actionable. And that's critically important and very hard to do, especially as inferred in the title, in this era of skepticism. So without further ado, let's welcome Dr. Donna Vorhees.
Thank you, Wei, for that very kind introduction, and I really appreciate the invitation to be here. And I didn't know I did so many interesting things. But the great thing is, if you live long enough, you have time to do lots of interesting things. But really, really glad to be here. I am with the Health Effects Institute. We're based in Boston, but we have staff actually across the world at this point on 3 continents. I'm going to start with this slide that's going to look really familiar to all of you. Maybe not this article in particular. This is just one that I happened to be reading when I was putting together these slides. But I highlighted some of the key sentences that we're all kind of painfully aware of. Not that the National Academies is doing a study, but that, being blamed as being partisan in doing this review, and then the retort is, we're not partisan, you're partisan with the DOE report, and I put the links here. I'm not showing it to you to go into any detail, but just this is our world. We're dealing with scientific controversy, and at least in this part of the debate, it's not even about the science, it's about the process and who believes who. And so I believe I'm here because at HEI we strive every day to produce science that people can believe, hopefully believe, and I'm just going to explain to you sort of how we do that, or try to do that. But this is the controversy today, but HEI's origins are born out of controversy. Controversy that happened back in the 1970s around the Clean Air Act. These are the words. In 1970, there was the Clean Air Act. EPA could set standards for car and truck emissions. Those emissions had to have an adequate margin of safety to protect health. In 1977, meanwhile, the auto industry and EPA are trying to figure out how to implement the 1970 Act. Now there's more regulations that say, vehicles built after a certain year will not cause or contribute to an unreasonable risk to public health, welfare, and safety. More controversy around how do you implement this. They were at loggerheads. The agency and the automotive industry were at loggerheads. How do we implement this rule? We don't know how to do it. What should be very easy was a huge area of contention between EPA and the automotive industry, and in large part around the uncertainty about the science of air pollution itself. So I dug back in history a little bit to figure out where did we come from. This is our 1985 annual report. HEI's been around since 1980. And this first quote, I find this very interesting. This is the VP of safety at Ford back in the 1980s, saying HEI was born out of necessity. And she makes reference to acceptable levels of risk, and this came up in some conversations with students this morning. How does an individual company substitute its judgment about what an acceptable risk is for all of society? Society has to decide that. And not only that, but the level of risk that's out there in the environment is a function of many companies, not just one automotive company. So the auto companies were sort of stymied about how they were going to respond and address what this rule, this new federal regulation, told them to do. Meanwhile, EPA, and there's lots of quotes, but I like this one, from EPA's Director of Quality Assurance, right? They wanted to set up an organization that would initiate studies, figure out what the health effects are, in a way that all the parties, the regulators and the regulated, would believe the underlying data. They may use the results differently, they may interpret them differently, but the goal was to have underlying data and science that they could all believe. And so HEI was born in 1980 to fulfill this purpose, at the time relatively narrow, looking at emissions of automotive vehicles. We've grown since then, but our mission's basically the same. We now do this work with 3 programs that I'll describe in a minute, but our overarching goal is to provide impartial science that informs decisions that foster a healthy environment for everybody. The 3 programs, a bit wordy, but I figured somebody's going to want these slides, so I wanted to make sure I explained them clearly here. The original HEI was the Environment Health Program, and this program is all about fulfilling or helping EPA and the auto industry both administer and adhere to those Clean Air Act provisions, right? And it's sort of tracing the vehicle emissions into the atmosphere, reaching people, potentially causing health effects, trying to understand that path. And that's what that program has been about for 40 plus years, now expanding their view. They're looking at non-tailpipe emissions, so everything's still within the transportation sector, but also looking beyond to emerging technologies and emerging fuels and understanding their health effects on human populations. The energy program is the one I lead. We're pretty new as research programs go, and we started funding research, and we've now funded 10 studies around population exposures in oil and gas producing regions of the United States. We're now working to broaden our work beyond oil and gas development to other critical energy questions. And in doing that, want to kind of veer away from the usual environmental health scientist approach of, something's happening in the world, let's go study it and find out how somebody's harming somebody's health. That's important work. That needs to happen. But the energy decisions being made today are being made quickly and across the world. And so we also want to make sure that we're taking advantage of the benefits that some of them could bring to health, and we take it all into account. So we're thinking about it more broadly in terms of both benefits and drawbacks of various technologies and fuels. And then the Global Initiatives Program takes a lot of what we learn in the other programs and translates it for low and middle income countries. And they're working to educate and working to help strengthen the capacity in those countries to address their own air quality issues. So those are our 3 programs. That's HEI. How do we work? What do we do every day? Our primary reason for existing is still that original one. We fund and support policy-relevant scientific research. Okay, so our next RFA is coming out, I hope, in a couple of months. But that is our main reason for being. We convene independent expert committees to select and oversee this scientific research. It's not just me sitting in a room deciding who I like best. We collaborate with and we convene researchers, policymakers, all kinds of people across the broader society to understand what the research priorities should be. We then take those results, we synthesize them, we interpret them, we communicate them, and we're doing this with audiences around the world. So trying to make sense of the scientific information so that people can apply it and reports don't just sit on the shelf. And we also engage with our audience to facilitate constructive planning and use of the science. And in a meeting earlier today, I made reference to something that I didn't put in these slides, but in recent years, there's been so much demand to release our research findings often before everything's all published and everything's all buttoned up. And so we developed some guiding principles for engagement to help us do that in an effective way while maintaining the scientific integrity. We don't advocate for specific policies. We advocate for great science, but we don't tell anybody what we think they should do with our science. We don't tell anybody, and therefore the air quality standard should be X. That's where we draw the line. So we're all about the science, all about the data, and laying it out there for people to use, hopefully to a positive end in terms of human health. Okay, I mentioned that we're going to be releasing an RFA, request for applications, and so if any of you are thinking, I might apply to HEI, you really want to listen to what I say about this slide, okay? So this is sort of how we work to really ensure the integrity of the work and the impartiality of the work, but it also makes it a little harder than your average NSF proposal, I'll say. First, our funding, we're a public-private partnership, so we have funding from government and industry, also philanthropy. That funding goes into a pot, and we fund researchers with it. They don't know that they're being funded by government and industry, they just know they're being funded by HEI. Our sponsors are in EPA, the automotive industry, the oil and gas industry, chemical industry. It's a broad array of sponsors. They often will share, their hopes and dreams for what research we might do, and that's fine. They're paying for it, but that's where their involvement ends. When we get to selecting the research, overseeing, peer reviewing, summarizing, communicating, the sponsors have no role in that at all. And when we're done, the research is made widely available. The selection of funding, selecting for funding, the oversight of research is done by a research committee. So we appoint an independent panel of scientists to oversee our research program. They work with us, with our staff, to implement that research program. So they decide the topic of requests for applications that go out the door. They select the studies that are going to be funded, or they recommend them for funding. They all fill out conflict of interest forms, as does our board. Every step of the way, we're making sure that the people involved with the science are working independently and are truly independent of our sponsors. Then, for the peer review process, enter an entirely different committee, usually similar, they're similar in terms of experience and expertise, but they do an independent peer review of the research. And when we release a report at the very end, it has in it something called a commentary, and this is a commentary written by this committee, a lot by staff, but the committee has to approve it. And so you have the research study, and then you have the commentary, putting that research study into the regulatory context, policy context, other research, and also the committee's take on the strengths and the limitations of the study. So you get in one package this independent peer review along with the research. But that's not all. Then most studies undergo a third-party QA/QC audit at the end, and some in the middle if they involve human subjects. So it's a very, very rigorous review process. At the end of it, when the research is all done, our board of directors must approve the research reports before they go out. And the reason for that is not that they're going to provide more technical input, but that they hold us, the staff, accountable. Have we followed the proper processes to ensure the independence and the quality of this research? And if we have, then they approve the report. All along the way, we're talking with folks all the time. I'm happy to be here today talking with you, and always interested in what people, the work and the type of research people think we should be funding. So if you have ideas, my electronic door is always open. I usually take questions, but I was told we were not going to do that till the end. So hopefully that was clear and I didn't leave anybody confused. I just want to convey our history in just a very few highlights, sort of where we've been. I mentioned we were launched in 1980. We've done a lot of work along the way. Pretty much all of it to date has been around air pollution. And if you look at the basis of any of the air quality standards, the US EPA National Ambient Air Quality Standards, you're going to find a lot of references to research funded by HEI. And that's not an accident. It's on purpose. We want to do policy. We want to fund policy relevant research. So we've done it on a wide range of topics, and since 1980 have broadened well beyond automotive emissions, looking at things like air toxics more generally. I'm going to give you an example of accountability research in a minute, so I'll skip past that, but evaluating different fuels, old and new diesel, providing some of the early evidence that new diesel is way better than the older forms. mobile source air toxics, what are the implications of some very low levels of pollution. This is where my program was launched. A multi-ozone center study, a collaboration among 3 different research groups looking at the respiratory effects of ozone in older populations. We did a major review on traffic-related air pollution. So this is the kind of work that we do. The trickiest work that we, that's the wrong thing. The trickiest work that we do, or I could say some of the more labor-intensive, are reanalyses. And there haven't been a lot, but this is a big one. So none of you look old enough to remember when there was a lot of controversy about the particulate matter standard in the US. And there was a big cry to say, we need to see the original data, you're hiding the data from us, and you're making us meet this really stringent standard. The solution was HEI, before I got there, was brought in to do an independent reanalysis of the 2 major studies that lay beneath that recommendation for a reduced PM standard, the Harvard Six City study and the American Cancer Society study. And it's a big deal. Data audits, independent verification of everything they did, reran models, tested the rigor of those models against alternate assumptions. And after, I think it was a 1.5 to 2 year process, the studies held up and the standard went forward. But it was a lot of work, and it all happened because people didn't trust the science and thankfully trusted this reanalysis. So that's just an example of some of the history, but I want to mention one more thing because this talk is around sort of trust and transparency is key to trust. Transparency and accessibility of data is really key to people trusting the work. And so now I do think a lot of you remember the secret science legislation back in around 2018. And our then president, Dan Greenbaum, testified about this at the time. And I'm just extracting a couple of key points he made. But the main one was that, we need transparency. You've got to have reproducibility. These things are central to good science. But we can't automatically release all data. By doing so, we could be endangering people's privacy, and worse, we would no longer find people willing to be part of studies if you're releasing, making their private information public. He offered, of course, not surprisingly, HEI's model for a way past this problem. But there is a way past it. I mean, we have a data access policy that has basically, at the end of every research report, there's a data availability statement, and it says, here's where you can find all of our data, here's where you can find all of our model code, here's the data that's confidential medical information for our study population, contact so-and-so if you are doing research and want access to this data. So don't share the data, but provide a path for researchers who might benefit and people who might benefit from that data to get access to it. Okay, some recent examples of policy relevant work that we've done. That was a little bit of the history, but I wanted to give you a couple of recent examples, and I think I promised the transportation sector and the energy sector. So in the transportation sector, there have been 4 broad areas of research. Here's that word accountability again, which I'm going to describe in the next slide because that's my example I'll share with you. But also air pollution mixtures, teasing apart these complex mixtures. I mean, the automotive industry knows they're not the only thing that's contaminating the air. It's mixed with so many things. So a great deal of research trying to tease that apart and with source apportionment research. Transport and urban health, again, lots of other sources, and also lots of other health challenges in an urban environment, lack of green space, some often poor communities, lack of health care. So all of these factors need to be part of that research. And I'm happy to see in presentations this morning, part of the energy modeling you all are doing. And then, of course, global health, along the lines of what I discussed before. I want to talk a little bit about the accountability research. I picked this because I love this research. It's basically research that examines some action that's been taken to improve the environment. It could be a regulation, it could be a policy, it could be a private company changing a technology, some kind of intervention that is intended to change a human exposure, ideally for the better, right? It can be a planned event or an unplanned event. We studied a whole number of studies on COVID. That was an unplanned event. planned event could be the building of a new data center, for example. But the way this works, and I saw a figure at a presentation this morning that looked just like this, but you have this air quality action, and before EPA or other agencies typically take them, they have to predict the benefits that are going to be associated with that action, right? So they have to think about, what are the emissions? Are people going to actually comply, right? What will end up being the ambient concentrations in air? And now you're doing all this modeling to understand where those emissions go. Is somebody actually exposed? Where are they? How much time are they spending there? Uptake, deposition, clearance in the lungs, all of that. Is there a health effect? Now we have to take into account the characteristics of the individual people, whether they might be adversely affected by this exposure. So you have an action, you predict what benefit you expect to derive. The point of accountability research is to say, did we derive that benefit? Did we see that reduction in emissions? Did we see that improvement in air quality? Did we see people's health get better? And so this is a fairly substantial body of literature that we have funded over the years, and we have a couple of active studies going today. The one I want to tell you about is one around reducing air pollution emissions from school buses. Sarah Adar from University of Michigan led this study, and it involved old school buses that where the school districts wanted to replace diesel buses with clean buses. And EPA has a lottery. I didn't know about this before the study, but there's a lottery to get the funding for these buses. And so one of the things that the research committee found so interesting about this study is that it basically simulates a randomized control trial where you have the people who win the lottery and people who don't, and those are your two groups. And they followed the children in districts that were selected for funding and children in districts that were not selected for funding. And the results were really pretty exciting. The ones that got the funding had fewer school absences. They did better on standardized tests. And in the districts that started with the worst air pollution, the greatest improvement was seen on tests in those districts. I think there was better air quality, I'm not so sure. A little unclear whether they saw improvement in health outcomes. And by the way, this is hard to do, right? Now, how many steps away are you from the emissions when you get to health? So that was a little bit hard to tell. But it's a very exciting study. And now, with the changes that are happening now, we're thinking about, now there's efforts to deregulate. So it's unfortunately another opportunity for accountability research. What would be the effects of that? If this kind of work is of interest to you, we have, and I'll mention it later, but we have a Science on the 7th with Pallavi Pant, and she interviewed Sarah about this work. So if you're interested in the study, I've got the link to the study in that Science on the 7th if you want to watch it. I tried to put links everywhere, and I assume somebody's going to ask me for my slides, so you'll have this if you want it. Okay, my energy example. So a few more slides on this, because this one I know is really near and dear to my heart. We started funding research in 2022, trying to understand population exposures in major oil and gas regions via air emissions, noise, and also water. And water has been the big controversy, right? You probably saw the tap water that lights on fire and that sort of thing. So we wanted to make sure that we covered that as well. And actually, I don't know how much you know about oil and gas, but just to be clear, this is getting extracted from very, very deep under the ground, thousands and thousands of feet underground. And I have this cute little cartoon of this short well, but actually these can go out for miles. So just to give you a sense of scale. I'm going to show you one study that we funded. We funded 10, but this one is nice because it links back very closely to technology, and I thought that might be of particular interest to you, but happy to talk about any of it. They studied VOC concentration increases near oil and gas wells during gas well drilling, completion, I'll explain completion, and production operations, right? And this is a typical well pad in Colorado. These are his slides, by the way, he and his teams. This one shows you a well pad. What was great about the study is Dr. Collette had the cooperation of several oil and gas companies in the region who allowed access to the well pad, who gave him data, told him exactly how long they were fracking on a given day, told them exactly how long they were drilling on a given day. So he could link that directly back to what he was observing in air and the noise levels that he was recording. I grew up around thousands of natural gas well pads in West Virginia. I had no idea that I had thousands around me, right? You can't live next to this and not notice it. So it's not really surprising that it became controversial. These are major industrial operations. Over here is the hydraulic fracturing operation where you have tons of trucks. Historically, they've been diesel-powered trucks, all roaring their engines, all that power needed to pump massive volumes of water, chemicals, and proppant, usually sand, down into the well. The proppant breaks open the shale, and the chemicals help keep the wellbore open, and things running smoothly, and I'm sure lots of other things, and then you can extract the oil and the gas. But it's a big operation. Drilling, also a big operation. Flowback, and I'll tell you why these lines crossed out in a minute, but flowback, once they drill the well and they pump in all the fluid, some fluid comes back out. It's called flowback. And in many operations, it volatilizes to air, and you have some pretty large emissions. In more recent times, there are some companies, not all, have closed loop systems for this flowback water. And this particular researcher, in the research we funded, was able to show that with those closed loop systems, almost entirely eliminated emissions from the flowback operation, which previously had been the worst part of the operations in terms of emissions. So that was very exciting. Somebody asked me about optimism, pessimism. There's a lot of good things happening in this industry. There's a lot of improvements in technology, no matter what else is going on. So, I don't know, a sign of hope. Some of the things are crossed out just because this can happen with drilling, with the diesel and natural gas generators. They just didn't have them in their study location. And they were at a study location, as I said, that had a closed loop system, so they didn't have this open flowback coming and emanating into the air. So that's why you see that. This is a really busy slide. Let me give you the highlights. Blue and yellow are 1 hour monitoring results. Green is weekly. The 1 hour meant to assess acute exposure for people, and the green represent what we consider chronic. Week's not really chronic, but they were simulating. That was their best thing, to simulate chronic. This is benzene, and let's just look at benzene. Looking at 3 different sites, and all these green bars are hazard quotients for benzene. A hazard quotient is the concentration they measured in air divided by a health guideline. So if your measured concentration in air is not higher than your health guideline, you're less than 1, you're good. Good news, right? So if you look at the green ones here and here and here, across all their measurements, across the whole box plot, nothing goes above a hazard quotient of 1 for benzene. So they basically didn't find any chronic health risk in their measurements. Now let's look at the blue. These are the blue ones compared to their benchmark, and we do see some exceedances. So some of the 1 hour benzene levels were associated with acute exposures of potential concern for people living around these operations. Now, this is 4 well pads in Colorado, one of the most highly regulated states. But it does show you that while there's no concern here, it's a pretty positive picture. Again, 4 operations, operators who were willing to have him do the research, and in a state that regulates oil and gas pretty stringently. But it suggests that there's a lot that can be done to protect people's health if you invest in electrifying these operations and closed-loop systems. The other really interesting thing about this research, and Wei used the word actionable, states have to establish, they don't have to, states do generally establish setback distances that separate people, homes, schools, from oil and gas operations. We call these setback distances. So this group did some air dispersion modeling and determined how far out, these are all the different operations, right? Drilling, fracking, for all their operations, they predicted dispersion of those emissions. And this is where they landed. The acute benchmark for benzene is right here at 9 ppb by volume. And here's Colorado's relatively new 2,000-foot setback distance. And the message is, yay, 2,000 setback distance is looking pretty good, at least in Colorado, at least for these 4 wells. And it was a big fight to get that 2,000-foot setback distance. It was a very big fight. And I spoke with oil and gas people myself who said, there's not going to be an oil and gas industry in Colorado if we change the rules this way. There is an oil and gas industry thriving in Colorado as far as I can tell. I don't know if they're thriving, but they're there, despite the fact that there is this new setback distance. That's today, that's 4 well pads, but we also care about the future and being able to predict. So this team put together something called the tracer pre-production model. Pre-production is all those steps we just talked about, the drilling, the fracturing, the flowback. And it predicts local air quality changes due to the well pad operations. And also you can plug in, if you're going to institute some kind of a method to reduce emissions, predict the effect of the reductions in emissions. So this model is interactive, online, in beta test. It's a beta test version at this point, but it's meant to be used by a lot of people, including operators, to figure out how to predict the impact they might be having and to do better as they move forward. This study, the state of Colorado is doing a review of several studies, including this one, I think in October, and it will feed directly into their policymaking and their regulatory programs. So we're excited about that. That's why I featured this one, because in terms of policy impact, it is as direct as they get. Okay. We do fund research mostly, but we do other work as well, and I just want to give you a little flavor of that. We care a lot about not just doing the research, and while we don't advocate for policy positions, we do advocate for the use of our science in this work. And actually, you may ask me, what was Dan Grunbaum doing testifying if we don't advocate? Well, he was advocating for good science. He wasn't advocating for a particular national ambient air quality standard, right? So we care very much about translating and communicating our work. A couple of examples. If you're interested, a colleague of mine, Anna Brasovsky, and I wrote a paper a little while ago about how we convene experts, the approach we use to convene experts to do research planning. We do a ton of convenings, and we work really, really hard to make sure the room is filled with people across sectors, across areas of expertise, different perspectives, all political stripes, but the common denominator being willing to follow the data, willing to listen to the science. And so we have very constructive conversations. So we have a lot of these. We have some coming up in 2026, some around energy topics. Science on the 7th, I mentioned Pallavi's first, and this one's coming up soon. So I just wanted to mention she's going to do one on satellite data, air quality, and health that you might be interested in. And if this talk ends and you don't know where to find this information, contact Wei or contact somebody can find me, and I'll happily get you the information. And that's just one of many kind of webinar type features. We have an energy and health webinar series that I don't know why I didn't feature it here, but I didn't, but we do, and it's all about energy topics and health. State of Global Air, I love this program. So this is, actually Bill Gates funded the original work here, but it's a massive online database, the SOGA database, of air quality data from around the world. And my colleague Pallavi Pant manages this, and she uses these data in, you'll never guess where, here, mostly here in Asia, so Africa and Asia primarily, places with severe air quality problems. And she uses these data to help educate and to help translate the knowledge we have from all of the research we've done and to help strengthen capacity for those populations to improve their own environments. So that's a big part of this work. The question she's trying to answer for them, right, and help them answer for themselves, how important is the air pollution risk? How important is it for people's health? What are the health impacts of exposure to air pollution? Are they changing over time? Are you doing better? Are you doing worse? What could be the reasons for that? And how do they compare to standards within countries and across countries? So if you're doing work internationally and you're looking for this type of data, this is a good place to find a fair bit. For energy, we have a number of resources online. I'll just point to this literature hub. We've been collecting literature on human health effects and human exposure and health effects from oil and gas development in the United States since 2014. So it's all in a curated online citation database. And this is what we call spatial bibliography. So you can go pick your favorite state, click on it, and find out what research has been done there in pretty short order. So we try to not just hold it all inside and when we find these things, release it to others. Unrelated to research, but really important. We're noticing as we hire people, right, that the same kind of people are walking through the door, and they're great, and we love them, and we have great staff. But it'd be really great to start capturing people earlier in their careers. So my colleague Ellen Mantis started this HEI Summer Fellowship Program that's now, I think, in its 3rd year or 4th year. And it's a 10-week summer fellowship with a stipend for the graduate student. We pair students with academic mentors. You can apply to be a mentor if anybody wants to be a mentor. The funding was done in partnership with the International Society of Environmental Epidemiology and Exposure Science, funding from American Chemistry Council, Clinton Family Foundation, and we do have individual donors because people are pretty excited about this. So it's been terrific. The students love it. I think my favorite quote ever was a young man who said, "I had no idea where I was going, and now I know exactly what my career trajectory looks like." So we were thrilled. We are scientists, so we like to sink our teeth into some of the more technical issues. So we do a series of syntheses, scientific knowledge syntheses and communication. So this project just ended. We just released this report on, what's today, Thursday? Tuesday. There's a lot of cry for cumulative impact assessment, which is a way of assessing the totality of what people are exposed to and how it can affect their health. This roadmap is intended for use by communities, states, industry, whoever wants to use it, to start grappling with that question of how do we assess that totality of exposure. And it is felt mostly in communities where they are experiencing multiple sources of contamination and are feeling powerless about what to do about it. So this is meant to be literally a roadmap to start them down that road. And we are applying for funding to test this roadmap into communities, hopefully next year. So fingers crossed that we'll get to do that. Back to the quality thing, back to the being believed. I didn't write this report myself. It's a whole bunch of HEI staff, but wait, there's more. We have an external special panel that oversees all of the work. They have to fill out conflict of interest forms. And then when the work is all done, our internal QA manager has to review everything. And then we had 7 peer reviewers on this project from federal and state government, industry, academia. So it has to pass a lot of hurdles before you see a report leave HEI's door. And then maybe the reason I'm here is a project that Wei Peng is involved in. But we are attempting to assess the health benefits of industrial energy efficiency. And we've just started this project to evaluate a proof of concept study where we think very holistically about the health implications of this case study in a given community, right? It's a specific facility in a specific place with a specific population and assess the real benefits that are derived. And oh, by the way, also be honest about adverse effects. Nothing comes risk-free. And so I'll comment on the timeline in a minute, but the plan was to have a case study selected in May and be done by October. So Wei knows this isn't going to happen. But that's just to develop the approach. How would we go about assessing the health implications? And then the ultimate goal is implementing it. And we're trying to pick a case study where we can do before-after empirical measurements, measure at least improvements in the environment, if not improvements in health. This is overseen by a special panel. These are the initial members. Wei is on it because we are so interested in thinking about this nexus of energy and health, and specifically being able to be in predictive mode, model to derive the benefit and not just be whining about what happened in the past. And then the plan is to have more members as we identify a case study. The timeline, it's been affected by the realities of our time. So this is one of our possible case studies. They lost all their funding. But, and a really nice person who really wants to do this project. We expect to overcome this. We have a couple of case studies in the wings, so hopefully those will happen. Okay, what's ahead at HEI? I was asked earlier how we decide on what research we do. We actually have a 1.5-year process of developing our strategic plan. It's now online, just came out in April. So if you want to hear or read about what we're planning, you can take a look at that. But just some highlights here. We're going to be releasing a request for applications around satellite-derived air quality data and use of those data in health studies. The second bullet is something we're hoping we can do. assessing near-term emissions, air quality, human exposures, or health benefits achieved by replacing older, medium, and heavy-duty diesel vehicles with cleaner technology. Now, that's a big, long sentence and a mouthful, but the idea is we're not going to get to 100% EVs anytime soon. Technologically, cost, but what can we do? What intermediate benchmarks can we hit that bring huge health benefit if only we just took the time to look at them? We'll be continuing some of our population exposure research, the industrial efficiency project I mentioned. This is the one where I'll be talking with Wei and others here, but we want to be hosting a convening next year on carbon capture, and specifically its use in data centers, but not exclusively. And I'll be honest, we could do a whole session on carbon capture because there's so many applications, and a whole session on data centers, and I think a lot of people are doing that, so we're leaning toward the carbon capture, but welcome your thoughts. And this is the thing that we've been asked for a lot by our sponsors, and is really hard to do. Technology agnostic decision framework for considering health in decisions about emerging technologies and fuels. I would love to chat with all of you about this. We've been asked to do it, and we're scratching our heads about exactly how. Our starting point is this industrial efficiency case study, but this is still out there as this faraway goal that we would like to get to. And with that, I'm going to say thank you very much for your attention, and happy to take any and all questions. And again, I was just going to say thanks again for the invitation. It's really nice to be here.
We'll just ask you to wait for the microphone so that we can hear your question more clearly. Any questions?
I'm just curious. My name's Glenn Hyman. I work with a lot of companies that can help in this healthcare initiative, and I do consider it a healthcare initiative. We are suffering here in the United States, we're suffering around the globe with increased healthcare issues and problems, challenges. But what if you could reduce toxic emissions with diesel and gasoline powered vehicles by 40 to 67% today? Would that be game changing? Personally, I think so. Guess what? Technology exists. What if you could produce crude oil end products, diesel, gasoline, aviation, fuel, etc., naphtha, with zero carbon dioxide emissions and with practically no greenhouse emissions? Would that be game changing? Guess what? Technology exists. So, and then we also have a major issue with regard to microplastics and nanoplastics, which are creating tremendous healthcare issues that are kind of invisible to us. Well, what if you could address any kind of waste plastics, end-of-life tires as well, that would eliminate that? Once again, I say game-changing. Once again, guess what? Technology exists. So I just wanted to share that with you. Again, I'd like to meet with you as well, offline or outside of this. But I just want to speak to the students especially. You are the future. You are the ones who are going to be addressing these issues. Whether you want to call them healthcare, whether you want to call it clean air, you can make the difference. It's not going to be my generation. It's going to be your generation. So thank you for attending today's session. Thank you for presenting it. It's amazing. And there are solutions.
Thanks for that hopeful comment. And I agree.
Hi, so I had a question regarding how you handle aspects of health that aren't necessarily acute, especially at the community level. So, I mean, perhaps it's easy to correlate, a chemical in the atmosphere to a chronic disease, but if we consider, a broader scope of health, the well-being of a community in terms of resource security and financial well-being, how do you make decisions on that, especially in terms of skepticism, what makes the cut and what doesn't, in terms of what can be proven using rigorous science?
Sure. First of all, ultimately, it's not me making all these decisions, right? There are these committees making decisions. Historically, in the environmental health field, we have been focused on, the easy stuff, relatively easy stuff, chemical exposures and their effects, and even that's plenty hard. But now, research more and more is encompassing a more holistic view of what people are experiencing in their lives, and it is far more than chemicals, right? So we have funded research around the effects of green space on people's health. I think access to healthcare is now in every epi study I've ever seen. So, it's in the cumulative impact project that I showed you, the reason we did that is because we know that most of the research we've funded over the years is very chemical specific. By the way, in large part because that's what you need to comply with the regulations. It's driven by those. But we know that we're missing a lot that contributes to people's health. So that's a first step for us to start to understand how to think about those questions. Our goal with that document actually is to start broadening everybody's minds to think the way you just described, to recognize that health is not about this little piece over here and this little piece, it's all of it. You need to think about all of it together. So we're hoping that it will get different groups of people thinking more broadly. In the end, you can't analyze everything, but hopefully by taking that broad take, you can identify what really is most important to improve people's health, if that's our goal, and then let's focus on those issues. So in that sense, we're looking at it all.
Hi, Donna. Eric Larson. Thank you for the nice talk. Given the relationship that you described between EPA and HEI historically, and still today, I guess, have you seen changes in the last 9 months about how your organization works?
So HEI has been funded since 1980 by EPA, along with all of our industry sponsors. So we can name all the presidents, starting with Reagan. but we've been up and down, and we still have funding. So what's changed is our partners at EPA have been primarily in the Office of Air and Radiation and Office of Research and Development. And a lot of our colleagues in the Office of Research and Development are not there anymore. So that's the change we're feeling. So there's, on the funding level, no. On the individual people whose expertise we valued, we're missing some of them.
Yeah, it's a fairly technical question, but I would love to hear your thoughts. I have been a big fan of the accountability research because those kind of empirical evidence, those kind of ex post assessment is critical to have, to have credibility regarding the impacts that are actually there. I'm curious to hear your thoughts about ex ante assessment, given that the energy transformation is going to happen at a scale that we have never experienced before. So we have to some extent, rely on modeling tools to thinking about if this policy is going to be implemented, what will potentially be the impact. So I'm very curious to hear your thoughts about how to think about the scientific rigor for this forward-looking analysis versus empirical analysis looking at the past. Do we need to have a different standard for this kind of projection type of analysis? And if so, how can we still maintain the level of scientific rigor that you folks have been doing for the ex post assessment?
Right. Oh boy. Okay. So, that's why I put you on the special panel, because and I know that's just the beginning of the conversation. And we have been talking with some other energy modelers at EPA. Some are still there, thankfully. Yes, we're going to need some kind of protocol standards, a way of doing this that where we can clearly create and also convey that same level of rigor. Do I know how to do it today as I'm standing here? I do not. I know really well how to do what we've been doing. And I can tell you, I've had research committee members say to me, because I've been pushing the cumulative impact and I've been pushing the energy stuff, and I've had them say to me over and over, HEI's strength is funding empirical research. Don't go there. My response is, I don't know how to stay relevant if we don't. It feels, and as a health scientist I actually want people to be healthier. So why do I want to sit around and wait to see what happens? So I feel like we have to do it. I feel like we have to do it. But I think I say let's continue the conversation. One thing we talked about earlier today, and I'll comment it on in this group, that research is never perfect. Even the empirical research is never perfect. But it is important for all of you as you pursue your scientific careers, when you have knowledge that is directly relevant to an important policy decision of the day, and you feel like you should share that, we need to come up with a way to help you do that in a credible way. That's why I'm talking to Wei, that's why we're doing this project. We're trying to figure out how to do that. It's always going to be tricky for scientists, right? You start advocating and now you're a politician, you're not a scientist anymore. But you should be able to at least share your data at a critical moment when decisions are being made. And I think it's just putting parameters around that, about what are you willing to share? Has it been vetted enough? I will say for the research we've funded, we have shared data along the way, not what we used to do, but we shared it once we knew that the data had been gone through a QA process, and we knew nobody was going to find out that, oh, the benzene levels are really 6 times as high as they reported. Like, we knew there wasn't going to be any of that. But we didn't have all the conclusions of the study. So you're asking the hardest question.
Do we have other questions? So if not, let's give Dr. Vorhees a round of applause. Thank you so much for sharing.
Thank you.